Then comes in is we develop heart attack and stroke. Next question is why cholesterol is dangerous. The cholesterol is dangerous because it blocks up our arteries, and the process is called atherosclerosis. What happens is, just imagine your body being a city which has got a bigger highways, which are your bigger arteries. Then they start breaking into smaller arteries, and ultimately those streets, roads, any street roads, there are cells. Like they have streets, there are houses. In between the houses, there are spaces, and those spaces are metaphorically, or the houses are endothelial cells. And these delivery trucks, which we call the LDL cholesterol, they are passing through that. And when there is too many LDL cholesterol, they call congestion, accidents happen. And metaphorically, they become oxidized. And when they get oxidized, they attract more inflammatory cells, and then the bigger cells, macrophages comes in, they try to swallow it, and they call foam cells. In this process, there is a lot of debris which is getting collected, and that's called atherosclerosis. And in this process, your lumen of the artery is getting smaller and smaller. Nature tries to cap it or kind of isolate by making a fibrous cap around it, and that does try to restrict or try to kind of limit its extent. And if many times, if the cholesterol content stays high in that cordon of area, it can lead to rupture of the fibrous cap, and this leaks into the blood, and that starts a new cascade of chemical reactions where there is a cells which are called platelets. They come into play, and they get initiated, and they become sticky, and they make a five mesh of cells, and then the lot of coagulation proteins comes in, they get deposited, and they make clot. And then artery, if this is the lumen of the artery, this clot start blocking the whole artery. Depending on how much the lumen is blocked, you get symptoms. If it partially is blocked, you will start having chest pain on walking or unaccustomed exercises. If the whole artery is blocked, then you will get, if it's in the heart, you could get heart attack. If it's in the brain, you get stroke. If you have in the leg artery, you may lose a leg. And depending on any organ system which is involved, there is another kind of cells, kind of cholesterol, which is a reverse transport. The LDL particles, starting as VLDL, IDL, and ultimately LDL cholesterol, they are the one which carry the cholesterol into the body. But whatever is not used needs to be brought back, and that happens from cell of the LDL part, the another kind of a cholesterol which is called HDL cholesterol. This HDL cholesterol brings the cholesterol back to the liver to be used. That is another lipoprotein which has a different marker. The on LDL cholesterol, the lipoprotein is lipoprotein ApoB, and this is a different kind of lipoprotein called apoprotein A1. This is the one kind of a towing truck which is bringing the garbage back to the liver. And when it comes to the liver has a receptors, and those receptors pick up this extra cholesterol. Either he uses, recycle it, or dump it. So that's what how this cholesterol kind of keep on circulating body based on the need. Liver produces it or absorbs it from the gut. It goes to the circulation from VLDL to ILDL and ultimately LDL cholesterol, and then brought back in the HDL. Question always comes in is why most of us know about LDL cholesterol and why we worry more about the LDL cholesterol is A, the way our blood tests are designed. When you get a blood test, you to always checks your total cholesterol, then they check it will report total cholesterol, triglycerides, LDL cholesterol, and HDL cholesterol. And then also, there is another term which is called non HDL cholesterol. If you look at it so far, when we talk about the cholesterol, there are two arms to it. One, which is the total amount of cholesterol which is circulating into your blood. That is the one which is going to get deposited into your arteries and can give you plaques. And then the other side is the HDL cholesterol, which is the one which is cleaning unit or the towing trucks which are bringing the cholesterol back to the liver. That is the one which cleans up your arteries. So there are two arms to it. So when we're doing the blood work, what we are trying to rationalize or understand, what is how much is the cholesterol which is going to get deposited, is it circulating in the body, and then how many those delivery trucks are there. When we talk about the bad cholesterol or the LDL cholesterol, there are two things which we are interested in. Number one, how much is the total LDL cholesterol, and second is how many is the particles, how many delivery, how many particles which are circulating in in the body. Smaller the particle, the chances are they can get deposited into arteries more than the bigger particles. So two things were the LDL cholesterol. And then the second part comes in is the HDL cholesterol, is the one, what is the good cholesterol, what is the cleaning part of our body working on. If you ever look at it, your cholesterol. And then next part comes in is we talked about total cholesterol, triglyceride, LDL cholesterol, HDL cholesterol, and non-HDL cholesterol. Let's take each component together. Let's do triglycerides first. Triglycerides are the one which is a whole hallmark of how much fat is into your circulation. And remember from our earlier discussion, how much fat which is being circulated in the body depends on your insulin. And if your insulin levels are high, your triglycerides will be high, and high insulin is a marker for insulin resistance, or possibly or possibility that what are your chances of becoming diabetic. If you just have your cholesterol profile and you see your triglycerides are high, you could bet on it that you have possibly developing insulin resistance, and you will or you may develop diabetes if you don't change. Next component is, and this high triglycerides tell you exactly insulin resistance, and insulin resistance come from your daily habits, how much processed food you're eating, how much processed fat you are eating, whether you're sleeping, whether you're exercising, whether you're resting, whether you're managing your stress. Now, coming to the next component is the total cholesterol. Total cholesterol has both good and bad in it. So, total cholesterol being very high is kind of give you an idea, but we want to know further. We want to know how much is out of that total cholesterol is the good side, how much is the bad side. If you have total cholesterol is high, but your good cholesterol is very good, that's a blessing. So don't go very excited if you see very high total cholesterol, because we do get a lot of question, oh, my cholesterol is very high. Yes, high cholesterol, the total cholesterol means something, but it may not be as bad as you think. The numbers to focus really next to triglycerides is your LDL cholesterol. On LDL cholesterol, that is the one which gets blocked into arteries, give you plaques. In no circumstances in a healthy individual it should be more than 100. Unfortunately, 71 million Americans have cholesterol level, total cholesterol, triglyceride level, LDL cholesterol, which is abnormal, meaning they are out of proportion or very high. And then their good cholesterol is very low. So the ratio of good side and bad side becomes very difficult. Next question comes in is the trying to interpret the relationship between good side and bad side. If your total cholesterol is high, but your HDL component is low, that is a bad sign. And usually, we want to see is that your total cholesterol to HDL ratio ideally less than 5. Next ratio which we care about is your bad cholesterol to your good cholesterol, meaning LDL cholesterol to HDL ratio. We want to be really keep it less than 3, but ideally less than 2. Then triglyceride to HDL level, we want to keep it less than 2, ideal is 1.5. These numbers mean a lot, and they significantly tell you a lot. Now, remember we lived a little bit about the size of the LDL particles. It is not a new concept. We knew it from a long time, but there were not good technologies available. But now in the lab, you could ask for to do ApoB level, lipoprotein level. Remember when liver produces VLDL, or when it gets converted into IDL and then eventually LDL, they all have one ID, which is ApoB. We could get ApoB level done, and that will give us bad cholesterol existing in different forms in your body. And we could go get ApoA1 level, which is the good side of the cholesterol, and we could measure it, and that will help us a lot to make a reasonable and wise decision, which we could do. Question is, and fourth question is, how can I lower my cholesterol? The cholesterol could be lowered only by either allowing your physiology to work in your favor. Those are diet, make sure your diet is primarily complex carbohydrates, adequate amount of protein, and your fats are either monosaturated which or polyunsaturated like olive oil, avocado oil. If you have to use saturated fats, use them in moderation and avoid trans fats. Increase fiber in your diet, manage your stress, sleep well, and exercise. These are the no-brainers so far. Then question comes in as a lot of people, they have high cholesterol, and I get asked this question over and over every day basis. How can I lower my cholesterol without taking medication or without even exercising? Say for example, so far what we talked about, if you take the exercise component out, if you start eating right and sleeping and resting, your cholesterol will come down. Exercise is a cherry. But say for example you don't want to do anything, what are the things you could take which are naturally existing in your dietary patterns? What we know so far is the way liver makes the cholesterol. I keep it very simple. There is a rate limiting enzyme which we call HMGs, core reductase inhibitors. The medication which works are the statins. Everybody knows about the statin because I have to talk to people on daily basis why they need statin, and why whole day we discuss why they don't want to take it and what all the bad things they know about the statins, which are completely baseless. But let's take it. Let's give you that you do not want to take statins. But statins exist in in your food, in your nature. Let's explore them. What are the foods which are like statin, and they will do exactly what the prescription pill will do it, and you could get it done? Number one is red yeast rice. That definitely, when fungus acts with this rice, it produces chemicals which goes to your body and act as natural statins. So red yeast rice can lower your cholesterol by 10%. It's not nowhere as effective as statin drugs, but as a natural statin, it can lower your cholesterol by 10%. Number two is CoQ10. Definitely have some data to back it up that it helps to lower your cholesterol by blocking HMG. Number three is garlic. Number four is turmeric. Number five is which we have talked about a minute ago, high fiber diet. These all act as natural statins. If you do not want to take statin, consider these options and you will be able to lower your cholesterol. Next question is, can children have high cholesterol? Absolutely, that's sad and unfortunate. 10% of our children under the age of 20 have unfavorable cholesterol, and their problem is not liver producing too much. They don't have a genetic disease. It's the parents and the school system giving them simple carbohydrate. If you look at the school meals, what is there? Soda, Pop Tarts, and all those junk which we feed. They have high cholesterol because of a dietary intake, not because of any fault of their own. They are growing, they are not nutrition specialists. It depends on parents to educate them and feed them proper food. Next question is, how often should I get your cholesterol checked? If your cholesterol is perfect, you don't have any other medical problem, probably 4 to 6 is a reasonable time. But if you are high risk to develop blockages or you already have heart problem, stroke, or any other problem, then your physician will guide you based on the treatment and what are the treatment goals you have. Next question, are there any symptoms of high cholesterol? Unfortunately, there is no symptoms of high cholesterol. In some cases, when it's not cholesterol, actually, when the triglyceride, the paradox is we kind of talk high cholesterol and high triglycerides together. They are not the same. High triglyceride level, when they are very high, they make your blood thick. You will be feeling weak, tired, and you could have a lot of other complication, including gallstone, pancreatitis, and all those things. But cholesterol itself doesn't have a symptom. The first symptom you will have is from the narrowing of the arteries. If it's a heart, initially you will have chest pain, unaccustomed chest pain, shortness of breath, heart attack. If it's arteries which are going to the brain, you have a stroke. If in the leg we have PAD, you have a lot of leg cramps when you walk, rest pains. So cholesterol itself doesn't have a symptom, but what it does to our body produces a lot of symptoms. Next question is, what food should I avoid to maintain unhealthy cholesterol? I think this is what we have discussed, but I will answer this question over and over, and I do this probably 10 times a day. Food is made up of macronutrients and micronutrients. When it comes to macronutrients, there are three: carbohydrates, fats, and proteins. When you talk about cholesterol, it's a game of two: your fats and your carbohydrates. If you want to eat properly to lower your cholesterol, eat complex carbohydrates and avoid all processed carbohydrates. When it comes to making a choice of fats, eat predominantly monosaturated or polyunsaturated fats, which comes from fish, avocado, olive oil. Second preference is saturated fats in moderation and do not go too high with that part, and avoid trans fats. So third thing you could do to lower this thing, which is not fat and protein, is to look increase the fiber in the food. If you increase fiber in the food, you will have very good cholesterol levels because it will bind and keep it lower. Next question is, can high cholesterol be genetic? Yes, there is a condition which is called familial hypercholesterolemia. Those are very rare disorders and those are very easy to pick. That is not the problem which word has it. Do you know, but in United States there is estimated that about 2.6 million people die just because of the cholesterol. and there are about 29 million disability days which are wasted every year directly or indirectly related to cholesterol. It is a huge problem and it needs to be addressed with a lifestyle. People don't want to take cholesterol medications, and the cholesterol medications, a, they cost money. Number two, they do have some genuine side effects, not to the point where the way we talk and do this thing. And I plan to next week do the live session only on the cholesterol medication, and we will take up this thing in detail and answer all the questions. If I do it today, the session is going to be very long, but we will take up this topic next week. How does exercise affects cholesterol? Whenever we exercise, our cells needs to be repaired, they need to grow, and the growing cell membrane is made up of LDL cholesterol, is made up of cholesterol, and the cholesterol gets picked up from your circulation, and you use it and you lower your cholesterol. It is recommended that you should exercise 30 minutes 7 days a week. Further, not only it picks up the cholesterol and lower it down, it also improves the good cholesterol. Your bad cholesterol goes down, good cholesterol goes up, and that is the beauty of the exercise. Are there any medication to help lower cholesterol? We all know medications which lower cholesterol, but I will just outline them today, and we will do in next live session everything but the cholesterol medication. See, our liver, we know that our cholesterol comes from two sources, our liver and our diet. So there are a lot of medications, primarily statins. They go to the liver and stops the production of your cholesterol. Those is the one place where the cholesterol medication act. Second, there are medications which goes to your gut cells and does not let your dietary cholesterol to be absorbed. That is the second target site. Number third site is that the medication which make your body bring more cholesterol come to the liver, and the receptors on the liver cells pick up all the bad cholesterol and destroy it. That's class called PSK9. PCSK9 inhibitors, that's the third place which you could act. Number four, there are medications which bind in the cholesterol and in the gut and you purge it out. Those the fourth class of medication. And there are medication which works with your triglyceride and lows. Those are fibrates. So there are 5 to 6 classes of different medication which work at the different target sites, and they either work through not letting your liver produce more cholesterol or making your gut cells not to absorb cholesterol from your gut, or make it purge through that part, or make your body's system be more efficient in the liver, that whatever cholesterol comes back, it destroy it. See, the liver is a two-way street. Liver produces cholesterol and destroys cholesterol, but it goes out from the liver when the LDL particle size and comes back from the HDL side. Next question is, how does smoking affects cholesterol? Smoking is one thing which is killing all of us. Smoking does not do anything on the bad cholesterol side, the LDL cholesterol side. But what it does is the apoprotein A1, which is on the HDL cholesterol, it goes and destroy that. So what will happen is, if you're a smoker, the good cholesterol will go disproportionately low. Your bad cholesterol will be a little bit high or normal. And that's a very classic smoker, because smokers don't have a very, you will find very rarely a smoker whose LDL cholesterol is very high unless they're doing everything wrong. Most of the time, the smokers have a less appetite, so their LDL cholesterol is not very, very high. This is not a rule, but that's most of the time. but their good cholesterol is very low. So the ratio between good and bad is very bad. So the ratio is in cubes, and that makes them very high risk for developing the plaques. So if you are a smoker, your good cholesterol will never ever come up, and there is no medication to improve your HDL cholesterol unless you stop smoking. And then the 15th question, which we have picked it up, is cholesterol a concern for older adults? It depends on, it's definitely a concern at every age. We used to think that the science which is good at 65 probably is good at 85, and that is not true. The goals of cholesterol are different at 65 and 85 because you are looking at it. A, when I'm lowering your cholesterol, what are I'm trying to achieve and how many years I'm adding to life expectancy. I've seen in our practices like we have one negative paradox, like irrespective of your functional status, irrespective of your age, there is target goals on which each practice, every physician is being evaluated. They call HEDIS and star measures. If you have 100 people, irrespective of what's going on in their life, their LDL cholesterol should be this based on whether they had a heart problem, they are diabetic, and they tend to ignore the age factor and how much life expectancy is left. In my opinion, definitely age has a lot to do with how much this whole process will play in. But I would say cholesterol is important at every age, but not to that intensity and severity we need to lower an 85-year versus 55, 65-year old. My goal here was to kind of answer your question, what is cholesterol is, what is HDL cholesterol, what is LDL cholesterol. We discussed how our lifestyle of simple carbohydrates, very high trans fats affect your good cholesterol and bad cholesterol and particle size. We talked about the medications, we talked about age, we talked about children, we talked about in the relationship of insulin. I will take up cholesterol medication next week. That way, we answer all the questions regarding the cholesterol medication in this live session. I hope you find some value. My name is Dr. Kulmeet Kundlas. I would suggest that we have created a playlist for the cholesterol. You watch it for more details. Like, share, and subscribe to our channel. And please do comment because that kind of keeps us motivated. And I want to thank Sayed, my team member, in producing these live sessions and YouTube videos. And I will see you next week about the same time about cholesterol related questions and cholesterol medication. Thank you very much.